Time now for our medical moment. Tonight we are talking about RSV. It's been on the rise this month. USA Health reporting more cases in infants and children, both in the community and in the hospital.
Experts say while symptoms are usually mild, sometimes RSV can be serious, especially for infants and older adults. Dr. Mukul Sehgal is a pediatric intensive care physician at USA Health Children's and Women's Hospital. Doctor, thanks so much for being with us. What are some of the warning signs that parents should look out for with RSV?
Sure. So RSV infection is just like any other viral infection. So it presents with flu-like symptoms. So you'll have cough, cold, runny nose, fever. Some of these kids, you'll see them like having decreased feeding. So if they're not taking as much as formula or the breast milk, and having decreased number of wet diapers could be another sign. So if you see a community outbreak or daycare outbreak with those signs and symptoms, those could be a warning signs for RSV.
And how do parents know when they should go to the doctor, make an appointment, or really seek emergency help for their children?
I'm glad you asked. So a lot of these kids with RSV infection, not everybody is that sick, but in terms of them going to the urgent care or the emergency room, what you need to look for is certain really red flags. So one of them, for example, is looking at how many times they're breathing per minute. So if it's less than 1 year old and they're breathing more than 50 times a minute, and the way to count that would be take the bare chest of the child and manually count how many times they're breathing a minute. And if it's between 1 to 2 years and they're breathing more than 40 times a minute, that could be increased work of breathing. In addition to that, two more important things is retractions, which you would see when they're trying to breathe. They'll be like pulling really hard. You can actually see the ribs pop through. And when you look at their chest, and the other one is they're not feeding well, that would be the other reason to bring the kid to the emergency room or the urgent care and call your doctor.
Well, doctor, what is causing this spike this time of year? Because it seems like we hear more about this in the wintertime. Now we're hearing more in the summertime.
Absolutely. It's very unusual to see so many patients in the summer, and especially a lot of those patients ending up in ICU. The reason that behind that is probably what CDC said is back in 2020, when the whole COVID pandemic broke out, we had this mask mandate. The masks were really good to protect against COVID, but they're also really good to protect other viral infections like RSV and flu. When that happened, although the viral infection during that period drastically came down, but also there was no immunity buildup in our kids in our community back then. And now we're seeing repercussions of that a little bit, and you'll see unusually high spikes when the masks have come out among the children and toddlers in this age group.
All right, with Dr. Sehgal with USA Health, thank you so much for being with us tonight.
Thank you so much for having me.